Yeah, I think it's a field that the current landscape for patients with Waldenström's for the management has been evolving a lot very recently. I think most of us feel very comfortable treating patients with chemoimmunotherapy and then BTK inhibitors. I think the sequencing is not very clear in terms of which sequence is the best, but those are probably your first two lines of treatments that will provide patients, with a good efficacy and durability of our response with a nice toxicity profile. Now, in the third line and following, that's the part that is a little bit more challenging because there are multiple treatment options, and the different options have not been compared against each other, so it's mainly single-arm studies. So at this time, we have venetoclax, which is a BCL2 inhibitor that showed high efficacy in the relapse setting. We do have Pirtobrutinib, the non-covalent BTK inhibitors, up and coming in a series of clinical trials, trying to find the spot for specific agents in the third-line treatment. I think from the trials that come to mind, we have the iopofosine 131 study that will be presented at ASH this year. We do have a study with an anti-CD19 antibody-drug conjugate, Loncastuximab tesirine. Very soon we will be opening a study with a bispecific against CD20, epcoritamab. So it's going to be very interesting to see which of these agents is going to be as effective or more effective than the other. We're going to be very interested to see as well the toxicity profile of these different agents. And that it will be challenging because it will make a little bit more difficult how we can select this treatment for patients. But I think it's optimistic in the sense that there will be a different option for patients. From the targeted therapies, we do have now second-generation BCL2 inhibitors with sonrotoclax, and we have BTK degraders that are supposed to be the next best thing in terms of BTK targeting. And obviously, only one can dream about a time in which we can maybe even combine immunotherapies with targeted agents, to treat patients with relapsed disease.